7 hidden foot signs that reveal diabetes. Think your foot pain is just from walking too much? It could be something far more dangerous. Most people brush off foot aches, tingling, or strange sensations as normal wear and tear. But if you're living with diabetes or even prediabetes, those small foot problems could be the first red flags your body is waving. What starts as a harmless dry spot or pinprick pain can turn into a stubborn infection, an open ulcer, or in the worst cases, lead to amputation. That's why recognizing the early warning signs in your feet isn't just important, it could save your limb or even your life. In this video, we're going to uncover the 7 hidden foot symptoms that often go unnoticed, but could be revealing much more about your blood sugar levels than you think. Let's get into it. Foot sign number 7, persistent foot odor. If your feet smell even after you've washed them, changed your socks, and worn clean shoes, it might be more than just sweat, especially if you're diabetic. Persistent foot odor can be one of the earliest and most overlooked signs that something deeper is going on beneath the surface. When blood sugar levels stay high for too long, it weakens your immune system and disrupts your skin's natural ability to fight off bacteria and fungi. This creates an ideal environment for infections to grow, particularly in the moist, dark areas between your toes or under your toenails. You may think it's just athlete's foot, but for diabetics, it can be a stubborn fungal or bacterial infection that doesn't go away with over-the-counter creams. What's worse is that because diabetes also affects circulation, your feet don't get the same blood flow that helps heal infections quickly. This means something that starts off as a little odor or a bit of flaky skin can quickly turn into cracked heels, open sores, or even lead to cellulitis if left untreated. The truth is, persistent odor is your body waving a red flag. It's not just about foot hygiene, it's about blood sugar, immune strength, and circulation. If you notice a strong smell that lingers no matter what you do, it's time to talk to your doctor or podiatrist. Catching these signs early can save you from bigger problems down the road. So the next time you slip off your shoes and notice that odd smell again, don't brush it off. It might be more than embarrassing. It might be a sign that your diabetes needs better control. Sign number 6, burning, tingling, or pins and needles. Have you ever felt like your feet are on fire or like tiny pins are poking you, even when you're not moving? That strange tingling or burning sensation, especially if it worsens at night or when you're resting, is one of the earliest red flags of diabetic neuropathy. Diabetic neuropathy happens when high blood sugar slowly damages the nerves, particularly in the hands and feet. At first, it may feel like mild numbness or a weird crawling feeling under the skin, but over time it can progress into sharp, stabbing pain, electric shock like jolts, or constant throbbing discomfort that interferes with sleep and daily life. What's especially dangerous is that these nerve symptoms often start subtly, and people tend to ignore them, brushing it off as poor circulation or just getting older. But when left unchecked, neuropathy can become permanent, making it harder to feel injuries, blisters, or wounds on your feet. And when you can't feel damage, you're less likely to notice it getting worse until it's too late. These strange sensations are not just annoying. They're your body trying to warn you that something is wrong with your nerve health and your blood sugar control. If you start noticing this kind of discomfort regularly, don't wait. Talk to your doctor. Early intervention, better blood sugar control, and specific treatments can slow the progression and prevent long-term complications. So if your feet are tingling or burning more than usual, especially at night, don't ignore it. It could be a signal that diabetes is silently damaging your nerves, and the sooner you catch it, the better your chances of stopping it in its tracks. Sign number 5, loss of sensation or numbness. Imagine stepping on a sharp object and not feeling it at all. That's the frightening reality for many people with diabetes who experience numbness in their feet. This loss of sensation is more than just uncomfortable, it's dangerous. When diabetes damages the peripheral nerves, it can dull or completely block signals from your feet to your brain. That means you might not feel pain, pressure, or temperature changes. A small pebble in your shoe could rub your skin raw. A minor blister could turn into a deep wound. And because you don't feel it, you keep walking on it, making it worse without even realizing. This hidden danger is one of the biggest reasons foot injuries become serious in diabetics. Numbness allows minor cuts, scrapes, or burns to go unnoticed and untreated. Without proper care, these small injuries can become infected. And due to poor circulation, which often comes with diabetes, the healing process slows down dramatically. What starts as a simple, painless sore can quickly turn into an ulcer, or worse, a deep infection that threatens the entire foot. In extreme cases, this can lead to hospitalization or even amputation. If you've noticed that your feet feel unusually dull or you can't sense texture or temperature like you used to, don't ignore it. Loss of sensation isn't just a symptom, it's a warning. Regular foot checks, blood sugar control, and medical care are essential to catch problems early and keep your feet safe. Sign number 4, slow healing cuts or sores. If you've ever noticed a small cut or scrape on your foot that just won't go away, that could be your body waving a red flag. In people with diabetes, slow healing wounds are a major sign that something's not right under the surface. Normally, when you get a cut, your body jumps into action, clotting the blood, fighting off bacteria, and rebuilding the skin. But with diabetes, high blood sugar can slow this process down dramatically. It weakens the immune response and narrows blood vessels, which reduces circulation. That means less oxygen and fewer nutrients reach the wound, making healing a slow and difficult process. What starts as a harmless nick from trimming your nails or a blister from tight shoes can linger for weeks. These sores may ooze, scab unevenly, or stay red and inflamed. And the longer they stay open, the higher the chance they'll become infected. For someone with diabetes, even a minor infection can spiral into something far more serious, like an ulcer that reaches deep into the tissue or bone. This is why regular foot checks are so important. If you see a cut that isn't improving after a few days or is getting worse, don't wait. Get it checked. Early treatment can prevent serious complications, including hospitalization or amputation. Slow healing wounds are your body's way of saying, I need help. And when it comes to your feet, taking that message seriously can make all the difference. Sign number 3, skin discoloration or shiny skin. If you've noticed that your feet are developing redness, dark patches, or a shiny, almost translucent appearance, this could be an early sign that your circulation is suffering. For people with diabetes, poor blood flow to the feet is a common issue that can lead to noticeable changes in the skin. The skin on your feet relies on good circulation to stay healthy and resilient. When blood flow is restricted, often due to high blood sugar, tissues don't get the oxygen and nutrients they need to repair and maintain themselves. This can cause the skin to become thin, shiny, and more fragile, increasing the risk of injury and ulcers. Discoloration, such as redness or dark patches, is another warning sign. It could suggest that the blood is pooling in certain areas, which means there's a blockage or reduced flow to that part of the foot. Over time, this can lead to inflammation and tissue damage, making the skin even more prone to breaking down. When the skin becomes shiny or thinner, it's a clear indication that it's no longer as healthy as it should be. This fragility makes it more susceptible to cuts, blisters, and ulcers that can be harder to heal. If you notice these changes in your feet, it's a signal to take action. Improved circulation, regular foot checks, and working with your doctor to manage blood sugar levels can prevent these early signs from developing into something much more serious. Don't ignore these subtle skin changes. They could be the first signs of damage that, with timely attention, you can prevent. Sign number 2, cracks, ulcers, or open wounds. If you notice cracks, sores, or open wounds on your feet, especially on areas like the heels or balls of the feet where pressure tends to accumulate, it's crucial to pay close attention. These types of foot injuries are common in diabetics, but often go unnoticed due to reduced pain sensation caused by diabetic neuropathy. In the early stages, these wounds might seem like small, inconsequential issues. However, with diabetes, they can quickly escalate into much bigger problems. The lack of pain sensation means that you may not even feel the injury when it first appears. And without proper care, these small cracks or sores can develop into deep ulcers. The skin's ability to heal is compromised by poor circulation, which is common in diabetes, making it harder for the body to fight infections or repair damaged tissue. What's worse, these open wounds, especially on pressure points like the feet, can become infected very quickly. With weakened immune responses from high blood sugar levels, infections can spread more easily, complicating the healing process and increasing the risk of more serious complications. In fact, untreated foot ulcers and infections are a leading cause of diabetic amputations. Once an infection spreads to the bone or becomes severe, amputation may be necessary to save the rest of the limb. Early intervention, regular foot checks, and prompt medical care are vital to prevent these wounds from spiraling into something life threatening. If you notice any cracks, ulcers, or open wounds on your feet, don't wait for them to get worse. Seek medical advice right away to avoid the risk of infection and more severe consequences. Sign number one, changes in shape or structure. One of the most concerning hidden foot signs is a change in the shape or structure of your feet. This includes deformities such as hammer toes, claw toes, or collapsing arches, a condition known as Charcot foot. These changes typically develop over time due to nerve and bone damage, a consequence of prolonged high blood sugar levels in diabetics. As diabetic neuropathy progresses, the nerves in your feet are gradually damaged, which can lead to abnormal pressure on certain areas of the foot. Over time, this stress can cause the bones and joints in the foot to deform, resulting in issues like hammer toes, where the toes curl downward, claw toes, where the toes bend downward, or collapsed arches, which leads to a condition called Charcot foot. Not only can these deformities make it difficult to walk comfortably, but they also affect your balance. As your foot structure changes, it increases the risk of falls and may make it harder for you to walk properly. Additionally, these changes can lead to increased pressure on certain parts of your feet, making them more prone to injuries like blisters, sores, or ulcers, further complicating diabetes management. In some cases, specialized footwear or orthopedic support may be necessary to manage these changes and prevent further complications. If you notice any changes in the shape of your feet, it's essential to seek medical attention right away. Early intervention and proper foot care can help manage these deformities and reduce the risk of serious problems down the line. Conclusion. These 7 hidden foot signs could be your body's way of screaming for help. It's easy to overlook or dismiss minor issues, but the reality is, ignoring these signs can lead to serious complications down the line. From persistent foot odor to changes in foot shape, each of these signs could be an early warning of diabetes-related damage, and catching them early can make all the difference in your health. Start checking your feet every day. Just a minute a day can help you spot any of these issues early. It's a simple step that could prevent bigger problems in the future. Have you experienced any of these signs? Drop your story in the comments below and share your experience with others. Don't forget to like this video, subscribe to the channel, and tap the bell so you never miss essential tips on diabetes management. Together, we can stay ahead of complications and live healthier, happier lives.